Khan, and welcome back to XO Medical Spa, and welcome back to the channel. Today we are going to talk about Pdo Threads. It's probably what I'm known for and what this practice is known for, because I've done it for quite a while and many places come to me just because of our beautiful before and afters and a lot of the cool treatments that we do with Pdo Threads. So what are Pdo Threads? A little bit of the back history. They're essentially just a dissolvable suture. So whether you've had surgery or you've had a cut or a nick or a doctor sews you up, the technology pretty much comes from that. Now PDOs used to be known as PDS. I believe it was back in the 1970s when they developed it for surgery purposes. So PDS is the original acronym for Polydioxanone. Now it's PDO for Polydioxanone, and those are the type of threads that we use here. So the ones I use here are Novathreads. I do use some other threads from other companies in regards to the different types of threads that I need. But for the most part, I do use Novathreads, which are FDA cleared, and I think the #1 brand in America. So let's talk about how we can use Pdo Threads. So commonly, people know it as the lift, the V lift, the face lift, the non-invasive don't go under the knife lift, which I really don't like to compare to that. So when you Google it, that's a lot of the stuff that you see in here. But for me, I like to think of it as another tool in our aesthetic toolbox on how we can use it. I'll never compare it to a facelift. I'll never compare it to surgery because nothing will ever touch that. In the realm of how you progress in your aesthetics or how you progress up to surgery, that's kind of the last and most invasive and also the most profound results that you can get. Pdo Threads is just a supplement on how we can do other things such as Botox, fillers. So we've talked about in the past, Botox addresses wrinkles around the face, fillers gives you back volume to replace volume to enhance, and then Pdo Threads I use for lifting. Now once again, we're not saying it lifts like a facelift, it's not lifting like goes under a knife, but it's a tool where we can lift strategically without adding volume. So fillers, we have to put in volume to try to lift. With Pdo Threads, we can implant a thread to lift without giving any type of volume. So we'll cut away, we'll look at some of the cool videos that I've done in regards to body treatments and face treatments, and then we'll come back and we'll look at the types of things that are in front of me, in front of the desk. So in this video, you'll see that we're treating the upper face, and if you see that insertion hole that I'm going through right now, there's a little thread poking through it already. So through one hole or as many little holes as we can, we'll try to treat as many areas without putting in too many insertion holes. So you can see the thread comes preloaded on lidocaine, which I really like to use. So every time I insert a little bit, I give a little pump of lidocaine, and that will make that area a little more comfortable. One of the concerns that people have is this really a painful procedure? And you can see this client is pretty comfortable, and I go at your pace. So whether we're going quickly or slowly, we give plenty of time, and we want to make sure you're as comfortable as possible. And you can see I'm just slowly inserting a little at a time until I get to my end point, which I think on this patient we were going to the corner of the mouth to try to lift that corner up. So once again, this is Pdo Threads, just slow insertion of a barb. So with Pdo Threads, in general, you have three types of threads. You have barbs, you have twists or screws, and you have smooths. And then hopefully you'll see in the top right corner here a little more close up on what those products are. So barbs are essentially the workhorses when it comes to lifting. And the way I want you to think about it at home is a PDO procedure will never do this to your face. It will never take it and grab and stretch. So you'll never have that stretch look. It's almost a physical impossibility to get that look. The tensile strength of these threads just can't do that. Now, some of the new Infinity threads, you can pull pretty aggressively, but in regards to these type of threads, you can't do that. So with barbs, what I like to do is, during these nowadays, we do a lot of Zoom consults and online consults. Take one finger, put it anywhere strategically on your face, and people do this subconsciously too, because when they come in and do a consult, they always say, hey, can you do this to me? And they take that finger and they start lifting. So put it on the corner of your face here. If your issue is heaviness and laxity in this area, take that finger and give yourself an elevation. Just lift. If that one finger gives you the correction that you're looking for, then this is a great option. If this one finger doesn't give you what you're looking for, then we have to look at other procedures, multitude of procedures, and a combination treatment as well. So that is barbs. That's what's going to give you the physical lift. But the thing that makes me different from many different providers is my usage of screws or twists and smooths. Because what happens is many practices, all they want to do is they want to give you that instant gratification. So they take a whole bunch of barbs and just lift the heck out of you. So you leave the practice, you're like, whoa, this is fantastic. But all too often you'll hear, my procedure only lasted 3 months, 4 months, 6 months. A lot of my consults, they'll come in and they say, hey, I've done this before, I like the results, but it just does not last. Because Pdo threads dissolve over time. They are a dissolvable suture. So over 4 to 6 months, those threads are gone. It's that collagen production that you've made in those 4 to 6 months that will give you the longevity of a 1-year result, a 1.5-year result, even a 2-year result. And if you go online, you'll see some of my patients I show are 2-year results. That's how you achieve this. So after you've done the lifting, now you have to place the smooths in there, which come from anywhere from 1 inch all the way up to even 3.5 inches, and twists. So the difference is, think of these guys is rebarb inside concrete. If you just lay concrete by itself, it'll break, it'll crack, it'll fracture, it just will not last. So how do construction guys fix that, right? They lay rebarb in there. So collagen is a natural lattice in our face. This is our collagen. When we age, it comes loosey-goosey. Take these 1.5, 2.5 inch guys and lay them strategically into areas that we know we've lost collagen, where we've lost structure. So these guys, when you place them, over those 4 to 6 months, you're building all this great collagen, and that's how you maintain the results. Because remember, 4 to 6 months, threads are gone. The lasting results comes from you personally building that collagen. So once again, we'll cut away, we'll show some cool videos on the procedures of putting in these twists and smooths. We'll come back and let's discuss other things that we can do with Pdo threads. In this video, you'll see that I'm using twists. It's a little farther away, but what we're treating is that smile line or the nasolabial line, that deep indentation when you smile or show emotion. We want to really fill that out. In this lower portion, we're treating the marionettes. So same purpose. Once we lift the tissue off of that area, we want to make sure that we're putting these screws in, these twists in, and these smooths to really build the collagen and soften that area. Because it's not just about the lifting, but you'll hear me reiterate over and over. Aging has to do with texture, pores, fine lines, and all those things. So all these little smooths, just like we said before, builds that collagen so your results will last a year, 1.5 years, 2 years, and beyond once the threads are gone. So in this last video, you'll be kind of wondering why am I putting these soft threads towards the back of the ear or the back of the face. So if you've ever noticed that hollowing that occurs below the cheek, we call it the preauricular area. Once that hollowing occurs, all that skin that used to be held towards the back of your face and up is falling forward. So commonly what we see as the issue is around the mouth, around the smile lines, isn't always the cause. The cause is everything that's falling forward and down. So we want to build that structure towards the back and really bring that tissue back. So once again, build the collagen, put these smooths in strategically so the results will last. So you've liked everything that we talked about so far, especially these educational pieces. Hit that subscribe button, give it a thumbs up. It really helps with the algorithm, and we'll continue giving these educational pieces, hopefully weekly, okay? So please stay safe, everyone, and we'll see everyone soon. Goodbye from Exo Medical Spa.